Hi, I'm Jennifer Parr, and at the Villages, our family is proud to have been a part of bringing you the most fulfilling, active adult lifestyle you can find anywhere. But even more important is our lifelong commitment to providing our villagers unparalleled health care so you can enjoy your retirement to the fullest. Today, we're here to focus on our more recent efforts in providing what is likely the most important piece for your health care, our Villages Neighborhood Care Centers. As a patient here, you enjoy a personal, ongoing relationship with your primary care physician who gets to know you as well as you get to know your doctor. Healthcare like you remember it, just a short golf car ride away, with care that places you at the center of your own well-being. Let's take a deeper look now at why the Villages, Florida's friendliest hometown, is fast becoming known as America's healthiest hometown.
We're all about the relationship between the physician and the patient, which is so important. And really that's what, when people think of the Dr. Welby, it was that relationship, that he knew that.
The Marcus Welby style reflects back to an age where relationships were the most important thing. And so when they delivered care, they had the full picture.
It's all about how do we go back to the idea that made Marcus Welby so popular, which is how do you get to know those patients? How do you have a relationship with them? And that really depends upon the design of your practice.
And here's how it starts. We begin with putting the patient at the center of it all. And the patient and his or her best interest is what everything else revolves around. And the first order of business after putting the patient at the center is to plug that patient in to a primary care specialist.
X-rays tell us about joints.
Each physician is capped at 1,250 patients.
Most primary care doctors have 2,000 or 3,000 patients or more to keep up with, so their phone's ringing, they got mammogram reports coming in and ER on the phone, and so they're really not able to spend time on you. But in this place, we have about half the normal panel size. So after you've met your new patients over the first 12 or 18 months, you're done. And now your job is just to get to know them as well as you can and just be there for them.
Our visits are all at least a half-hour slot with our patients, which is really unheard of. So when you have that time at the bedside or in the exam room or sitting down and looking at a patient eye to eye, and that really is what fosters ongoing great healthcare. So for us, it is all about that relationship, and our practice, our design is set up in such a way that it enables that relationship to take shape.
The facility that we operate this patient-centered medical home model out of is quite unique.
Having labs and x-ray in-house is very favorable as far as being able to turn information back quickly to patients. And they can have all of their diagnostics, both laboratory and x-ray, done in-house rather than having to commute to another facility. It's just so much ease for the patients.
The electronic medical record is an easy way to track patients' health care and have accurate, detailed information.
I see that having electronic medical records in practice benefits patients in several ways. Number one, for the continuity of care between the providers who might be seeing the patient. Alternative providers seeing different patients at different times. And so the information is right at the fingertip, right at the ready. And the other way I see it benefiting patients in particular is when we're on call or we're working remotely from our homes and I have patients on the phone, it's just a quick click of a button to get their whole medical record up in front of me so that I can access their care at just a click of a button.
It's not physician as doer anymore, it's physician as team leader. And so we really take care of patients as a team.
That's what we're all about. We are all about team care. We take care of you as a team. I tell every new patient, you're coming to see me, but there's a whole team that supports me, and you need to know about all of them because they all have a role to play in taking care of you.
It's not just physicians and patients, but extenders as well, nurse practitioners and physician's assistants. So it's likely if your primary care physician isn't available, another primary care physician may be, or a nurse practitioner or a physician's assistant.
We have same-day slots that are reserved for our established patients. And I'll be clear about this. We're not a walk-in clinic, we're not an urgent care center, but for our patients who are established in our practice, they can be seen on the same day. We hold slots specifically open on the providers, doctors, and extenders schedules.
What's really neat is in the morning, before the first patient is seen, everyone involved on the team will get together for what we call a huddle, right here in a huddle zone. And we'll be looking at everybody who's coming in that day, and we'll take note of, oh, that person, we need to get those records and be ready for that, or do we have those lab results? We have a collective sense of what we need to get done today. And we end the day with a huddle, looking back on what didn't go right today. What weren't we quite ready for that we got to learn about and not have that happen again? It's quick, but we learn something every day, and it helps us be better the next day. It's just a wonderful process.
Our care centers are conveniently located throughout the villages. We have 6 primary care offices, and we have 1 specialty care office that's located adjacent to the village's hospital.
All of the various areas. We've got Colony and Pinellas down sort of in the south corners, and then here Creekside right in the middle. You got Mulberry up north, Santa Barbara up north, and it really does work. It really covers all areas, all square footage, if you will. Everybody's a golf cart right away.
The doctors that choose to join us are the ones that enjoy the process. They enjoy getting to know the patient and the relationship-based care. There are doctors who are good explainers, people who like to teach the patient what's going on and help the patient be in charge of their own health care. Doctors who are naturally good at that are choosing this because we allow it and encourage it and even require it more than most practices would.
Well, let me say that other than it's a beautiful environment down here with the weather and all, I didn't have to leave Boston. I had a very nice job. I was very comfortable. But when I did investigate the villages, I knew that if this is the way medicine can be done, then it should be done this way. And then I knew in the system that I was in, it would be decades before it would ever get there. And so I just didn't want to lose out. I wanted to be part of this.
I was a little comprehensive about changing doctors, and I got a doctor, and she asked me all kinds of personal questions about my health in recent years, and she gave me some tests, and through those questions and tests that she found, through her and a cardiologist found a blockage in one of my veins. A week later, I had a stent put in. Theoretically, she saved my life.
My first impression was when I met my doctor for the first time, gave me just an extremely complete exam, one of the best I've ever had. But I feel like the overall experience is that I'm the center of attention. When I come in, everything's about me. It's not about the doctor or anything else, it's just about me.
I'm being joined by my brother Mark. We wanted to take a few moments to give you our family's perspective on our healthcare initiative and why it's so important to our community. Mark, why don't we start a little bit with the history of our initiative way back when?
Well, our focus has always been on what is best for the people in the community. We've always been able to provide high quality recreation. We've always been able to provide high quality entertainment venues, town squares, and all the things that we bring to the community to create the lifestyle that's here. And we've been looking and finally found this patient-centered medical home system that focuses on the people in the community. And that's really why we went into the village's health system the way we did with so much vim and vigor, is because we finally found what we thought was a path to having the people in the community be the center of the system.
The village's healthcare brand, why don't we talk a little bit about where that came from and how we came up with the village's health?
The hospital and the certificate of need process and the growth and the expansion of the hospital, that's really, as we learned over the years, that's the acute care side of the health delivery system in the villages. So we changed our focus to the primary care side, and that's where the village brand of medical delivery system is that we put together. We have 6 care centers open now, staffed with somewhere between 6 and 8 physicians and care extenders and wonderful lobby hosting people that'll help you through your journey, and very hospitable.
I'm thinking it's been just a little over a year since our first care center actually opened to receive patients. Is that right?
That's right. That's
so,
right. About 18 months since the Colony Care Center opened, and we've opened all the other 5 since then.
The village's health and our neighborhood care centers have been pretty well received by our residents, wouldn't you say?
Yes, they have. To date, we have right around 37,000 patients that have enrolled
Nothing more important than your health.
That's right. You can't enjoy the recreation unless you're healthy.
We talked with several different people about this concept and different insurance companies and so forth. And why don't we talk a little bit about our partners?
We did. United Healthcare, we sort of chose them, but they also sort of chose us. They really bought into this concept. They're vested in it. They opened up storefronts, which is in the community, which is unheard of. And they have access to big data that helps us provide cutting edge and successful medical delivery to the patients in the community.
They've really embraced this concept. They've made the Villages their hometown as well, making it a healthier life for people. It's very important. Let's all be a part of healthcare the way it should be. A one-on-one relationship between doctor and patient, just like it used to be. You can help spread the word by sharing this video with fellow Village residents, as well as your family and friends back home. If you're not already a part of the Village's health, what are you waiting for? To learn more about the Village's health and where to find our care centers, visit thevillageshealth.com.